Torosis has done this Delphi study making a proven algorithm for high-tone pelvic floor dysfunction. And basically what they're trying to do is get everyone across the board here to agree on how to manage high pelvic tone and pelvic floor dysfunction. So basically, we have a whole bunch of OBG doctors and two physical therapy PhDs who are going to do a Delphi study. Now, what they've come out with is a total of 31 statements roughly that guide how a person should be managed. But the start is that the first thing to be done should be a pelvic floor physical therapy program. And if the patient says they feel better, well, it's wonderful. This should go for about 8 to 12 weeks. If there's no improvement, then people should progress to trigger point or tender point injections. If those don't work, vaginal muscle relaxants, cognitive behavioral therapy, or even Botox, which should be a third line. Now, if nothing is working, they should be thinking about sacral neuromodulation. What they're saying as a problem is most of these people have an access issue. They can't actually get to a pelvic floor physical therapist, which is not a surprise, especially in India. Many therapists want to be generalized, or they are more interested in calling themselves doctors and actually learning these kinds of things. The other part is it's hard to get these things done. And more importantly, the problem I see here is there's many times a person will have a pelvic floor issue or a high pelvic floor tone, but exercise can't correct it. And there's a reason for that. It's because this is going to be psychological stress. There's no exercise program for psychological stress. Doing aerobic exercise does help make a person feel better, activating the endogenous cannabinoid system, but it's not a cure. And this is the problem that we have with this. Now, they've missed really important things like neurotherapy that actually address the person based on who they are and what they've experienced in life. So it's a good attempt to homogenize a kind of emerging field. There's a strong bias for exercise, probably because the people who do this don't know there's other treatments around that can be done. But for what it is, it's something that can be done. And if a person can't get a physical therapist, there's plenty of yoga programs that can address the pelvic floor. There's YouTube videos, etc. So it's not a bad attempt, just it misses the bigger picture. Meaning, by the time a person has failed all of this, before they get a surgery, they should be meeting a physiatrist for neurotherapy.